Herpes simplex 1 is a viral infection. So this is different from what we talked about with genital herpes. So, genital herpes is herpes simplex 2, herpes simplex 1 is herpes elsewhere on the body. So it's when the virus enters the skin, basically through the site of an open wound, and it settles in a nerve ganglion. So once someone has a herpes infection, there is always a chance they'll have a recurrence because the virus is always in their body. The two types you look at, herpes gladiatorum, which is basically herpes on the trunk. Herpes labialis is the herpes around the lips or the cold sores. The reoccurrences are caused by multiple things. So, and the second occurrence is usually not as severe, but things like sun exposure, stress, infections are all things that could cause the infection to reoccur. Much like with some of the other conditions you've been talked about previously, also be sure to note particularly the rules as it relates to the NCAA with wrestling. That becomes a very important thing when you're looking at some of these skin conditions. Molluscum contagiosum is again another viral infection. You see this common areas where you see this: the face, trunk, arms, legs, and genitals. The classic presentation of this is a little dome-shaped lesion with what they call a central punctum. So it's basically usually a little pink dome-shaped lesion with a little indentation in it. So usually if you see that, that's indicative of a molluscum contagiosum. And again, this is spread by skin-to-skin contact, so it is contagious. Warts are another lesion caused by viruses, caused by the human papillomavirus. So all your different warts that you see are caused by that particular virus. The treatment's going to be basically based upon the different location. There's various types of over-the-counter treatments many of the times that individuals will use. They are contagious, so they should be covered. If they are on the face, an individual cannot wrestle with those. Very common to see what we call plantar warts form on the soles of the feet. So what happens with different with plantar warts, because we walk on our feet, the wart grows almost inside of the skin, whereas on, like, for instance, on the hands, they grow out more superficially. So sometimes that would make plantar warts sometimes a little more difficult to treat. The best thing would be for prevention, just making sure to keep your feet dry, and if you're in a public shower, making sure you wear something on your feet to prevent the acquiring plantar warts. So now we look at some different fungal skin infections. So Tinea Corporis, or what's also known as ringworm. So it's a fungal skin infection caused by skin-to-skin contact. It's caused by a dermatophyte. Okay, so that's what basically causes the fungal infection. Develops best in dark, damp, humid conditions. So very important that, like, athletics equipment and everything, is kept in an area where it's ventilated very good, and that the equipment is clean. It gets diagnosed. Many times people just diagnose it by looking at it. If they do have to confirm, they do a potassium hydroxide stain, which basically then can differentiate whether it's Tinea Corporis or some other type of condition. But that's what they'll do to definitively diagnose it if they're not sure. So when you're looking at your treatment, the length of treatments are very important. So depending upon what type of medication you're using, you have to make sure that the individual uses it, because many times with most of the medications, you have to use it beyond even when the actual lesion is gone. You still have to use it on the skin for a little while. One prevention measure, and you could do this with wrestlers, is that when they shower, use a Selsun Blue shampoo on their skin. Could help prevent Tinea Corporis from forming. Tinea Corporis is a fungal infection in the groin, also known as jock itch. So the proximal thighs, groin, buttocks. Many times this is mistaken for chafing. So, many times people from their thighs rubbing together will get what's just called chafing, where the skin basically gets irritated, and from sweat and the skin rubbing together causes the irritation. This is different from that, so you have to make sure you differentiate it. And some of the signs and symptoms that your text talks about will tell you how you do that. Some of the things that could predispose people for this: tight clothing, obesity, and chronic corticosteroid use, because corticosteroids do suppress the immune system, which could put the person at risk for developing fungal infections. Tinea Unguium, ringworm of the nails. So this is when people get the thickened yellowing of their nails on the feet. You can't treat this with topical antifungals typically. Some newer medications have come out that are topical, but they are relatively new. Many times in the past this was treated with oral antifungals. Your predisposing factors for this: hyperhidrosis, so the increased sweating, diabetes mellitus, age, poor venous and lymphatic drainage are all things that can put people at risk for Tinea Unguium. And then Tinea Pedis, athlete's foot. So you see this commonly form in between an individual's toes. Prevention for this, again, shower shoes, so not walking around in your bare feet in public showers, keeping your feet dry, and powders.